the same of Dr. Janine Domingues for when I saw the ponies in the Hamptons. You were praising her.
I know. Like, of course he'd be somewhere in the Hamptons. I never know where he is, but he's always somewhere.
When I was quelling over you, he agreed with me. So
Oh,
without further ado, here is Dr. Janine Domingues.
all right. Let's see. So I don't have to go through the whole thing, but since I just
teach us.
I was going to do a little mindfulness just to sort of like help us get in the right space. So if you guys want to do it together,
sure.
Sure.
I just figured with all the craziness that is this summer and this past year and a half or longer and what we're going to be facing, might as well do a little mindfulness to get us started. So if you can sit comfortably wherever you are, and if you can, ground your feet on the floor. And if you feel comfortable, close your eyes. And if not, you can just softly gaze at a point in front of you. And I just want you to take a deep breath in through your nose and out your mouth. And just do that a couple times, taking the deep breath in and out. Maybe noticing your mind wandering, and that's okay. Bringing it back to that breath. And as you're breathing, really feeling as you're taking your deep breath in, taking in fresh, cool air, and releasing tension as you breathe out. Maybe noticing a part of your body feeling tense. And as you breathe in, really breathing in fresh, cool air, and breathing out that tension. Bringing your mind back to the breath. Taking one last breath in and out. Then when you're ready, you can open your eyes and come back. So that was just a very quick mindfulness, but noticing any change or not change, anything you enjoyed or didn't like, that's okay too. I always tell the folks I work with, mindfulness isn't about necessarily getting calm, but is just about getting here and being present. So it's okay if you don't enjoy it. That's a preference, but and that's just being aware and being in the moment too. Okay, so a lot of this intro you guys already know, but what I wanted to like sort of make us acknowledge and aware is really the typical school year usually comes with typical social and academic stressors, especially after the summer, coming back to school nerves. And this school year is really heightened, right? The effects of the pandemic coming back to full classrooms, theoretically, coming back to full days. You know, I worked with a lot of teens and tweens and younger kids where their days may have been half days or they were done by noon or 1. And so now presumably we're sort of in it for the whole day. And so thinking about what that means socially, what that means coming back to the school year. And I also wanted to acknowledge too, like in addition to the pandemic, there's been a lot of current events really highlighting systemic racism and what that means for students coming back in terms of their own identity and the socializing and what they're going to be talking about in school too, I think adds to sort of a new, maybe not new, but an atmosphere of maybe some anxiety as well. And we also know outside of the pandemic, even prior to all of this, 1 in 5 youth really suffered from mental health or learning disorders. And 50% go on to develop a mental health disorder before the age of 14. So when we think about what the pandemic has really highlighted, who knows what we're going to see after this? You know, research is still being done, but we know that certainly there's been a heightened sense of anxiety, depression, and so trauma, grief. So we know that we're going to see a lot more in terms of the aftermath and the effects of the pandemic moving forward. While anxiety disorders are one of the most prevalent psychiatric illnesses, ADHD, follows, right? And so, as I mentioned before to both of you guys, I often see sort of the comorbidity or the cycle between the two in my office. And then as kids get older, sometimes we also see sort of the secondary depression and depressive symptoms as well. You guys know all of this, so I don't have to go through the what ADHD is. But as we think about sort of coming back to school, anxieties around.
Wait. There's 11 people. You know what? Here's what you need to. Well, wait. Admit all.
Ellen, you need to mute yourself.
Peer relationships, daily routines, completing classwork, all of these things that we know are sequela to some of the symptoms of ADHD. And certainly, as we're coming into the school year, can cause, again, some of that anxiety about starting the school year. Well, I can ask you guys, any worries or fears about the transition to back to school?
Dr. Domingues, I just want you to know that 11 people just came in. So, yeah, so I don't see anybody at this moment, but I just would like to welcome everybody and say I'm sorry that it took so long to get people in. There was some technical difficulties, and we are thrilled to have Dr. Domingues here with us. Would you like to just continue, or do you want to go back and start a little bit? However, whatever you're comfortable with.
Mm-hmm. Sure. Hi, everyone. Thank you for joining. So yeah, I don't know if let's see if, okay. I can just go back a little bit.
Perfect.
Well, we're at the Child Mind Institute, just so that way you guys know where I'm hailing from. A national nonprofit dedicated to transforming children and families struggling with mental health and learning disorders. And really, I was just highlighting sort of the environment of what we're going into in terms of the school year. Typical school year stress, around taking a break in the summer and coming back to social and academic stressors, back to school nerves, but now really highlighting the effects of the pandemic and what that's doing in terms of kids really having heightened sense of social anxiety, greater demands around more attention, going back to school full days. What does this mean in terms of interactions with teachers? Back to school nerves have increased, and just highlighting two other current events around, the scope of systemic racism and other things that might come up within the school environment as well that might add to anxiety. So with that being said, and also knowing that 1 in 5 youth suffer from mental health and learning disorders, I really wanted to focus this talk on how we can help our kiddos transition successfully back into the school environment. So I certainly see kids with ADHD on my caseload, but my focus is usually on anxiety. So I really help kids with anxiety symptoms, depressive symptoms, and oftentimes the kiddos that I see in my office who have ADHD also have a comorbid or co-occurring anxiety disorder or depressive disorder. And so just thinking through the anxiety symptoms and the stressors that our kids might face in terms of coming back to the school year, I really wanted to focus the talk on how we can really support the emotional well-being of our kids. Okay. So where I'm going to start is really with you in terms of self-care. So Dr. Kopowitz, the president of the Child Mind Institute, his like go-to phrase right now is self-care is childcare, and it's very much true. So sort of if we're in a place of regulation and sort of thinking through how we're coping with the upcoming school year, it's really going to benefit our kids, right? So scheduling that self-care, really thinking through what barriers are in place. I know for myself, being a therapist, I always want to problem solve and do and just keep going. And I recognize that that is not always the best for myself or for my son or for my husband. So I also need to sort of plan and take care of myself before taking care of others. Really highlighting, especially this year, and I'm sure everybody felt this too throughout the school year, how communication is really key. And so we're already in August and really thinking through how we're going to be communicating to our school, you know, new things that you may have been seeing with your kids or with your teens. You know them best, what's going to be needed, how can you advocate for their needs in the school year, not being afraid to really ask for that help. Also with balancing that teachers are adjusting here too. I was just saying before, now with the Delta variant, we might have to be even more flexible and adaptable to what the school year might bring. But I also like this idea of including your kids in the communication as well. So starting that communication with them too, you know, from, you know, what are you thinking about school? What are some of the things you're excited for? What are you worried for? How can what should we tell your teacher this year? What's going to be helpful to you, you think? So that way they can also be part of that process and understand how important communication can be. And also you're helping them to facilitate advocacy for themselves and their needs. Thinking through behavioral support too. So we know through ton of data and research that in the midst of chaos and unpredictability, one of the most resilient factors is creating your own predictability, right? So really helping yourself to maintain and even reestablish routines and expectations. And again, that can start now, sort of what your mornings are going to look like. What's it like to get ready and get up and out of the house? You know, that was one of the things that even in my own household, we really practiced when we were kind of re-engaging in the world, and you know, having my son go to camp and me go to work sometimes and actually leaving the house, that became sort of a routine we had to get into. Setting realistic goals for what the expectations are going to be during the school year as well, in addition to holding and balancing, really modeling flexibility and being adaptive. So if at the end of the week something really didn't work, all right, how can we work around it? What do we need to tweak? So that way we can sort of make the routines really work. And we especially know, especially with kids with ADHD, like previewing and practicing the routine and what to expect. I know this for a fact with anxiety as well, just really sort of going through what it's going to look like, in addition to saying, and if X, Y, and Z happens, you're going to be okay too, is also going to be really important during the school year. So setting the tone, even before we get into any skills, I kind of always want to go through a little bit of validation. So as I mentioned before, being sort of a problem solver and sort of how do we fix things, sometimes going into problem solving mode or fix it mode can inadvertently invalidate your kid's experience, right? So we sometimes need to take a pause and just validate feelings. I always say this, any feeling is valid. We might not like what the behavior is after the feeling or how they've decided to tackle the problem solving of that feeling, but any feeling is valid. And so really just doing this for others and yourself too is really important, because it actually communicates to your kids that it's okay to feel, that when you're feeling uncomfortable or in distress, that you don't need to do anything about it, that it's okay and we can sit with it. So the do's of validating are really listening, reflecting. So, I hear that was, really scary for you, or you were feeling really worried. I get that. I would be worried too, and really connecting at their level and catching, if you're cheerleading them out, oh, don't worry, it's okay. I'm sure nobody noticed. Or turning to logic or trying to fix it right away. I know that we are pulled to do that, but trying not to, and really just sitting and reflecting is kind of the foundation for then afterwards really helping to solve or whatever it is next. And this is kind of the beginning really of emotion regulation, really trying to validate, because oftentimes if we talk ourselves out of a feeling, then, or inadvertently talk our kids out of a feeling, then they go on to question why they feel the way they do, or they go on to question whether they should or shouldn't feel the way they do. And that can be confusing and can lead to other issues. So in my practice, we are evidence-based, and we're really rooted in cognitive behavioral interventions for all mental health disorders. And I was thinking through kind of the transition back to school and sort of the foundation of CBT. So really in cognitive behavioral therapy, we think about emotions through a thoughts, feelings, and behavior lens. And one of these bubbles really influences the other. So the way we think about a situation really affects how we feel internally, how we present externally, and then does really affect what we do. And vice versa, what we do might also affect how we think about a situation and then how we feel as well. So the next couple of strategies are really trying to think through each one of these bubbles and a little intervention or practical skill that can be done that might help within each of these areas. So the first really might seem really simple, but also really important, and I would say is one of those foundational skills, is really just identifying and labeling a feeling. So what we know, especially with anxiety, right, in the brain, there's the amygdala. It's that alarm in our brain that goes off. It kicks on the fight, flight, or freeze response. And sometimes it gets really loud. And when it's super loud, we are dysregulated, and it's hard to really think logically. It's hard to do much. But one of the things that can be really helpful is just labeling how you're feeling. And so we know putting a word or putting a name to a feeling actually activates that frontal lobe part of our brain that turns down that alarm, that amygdala. So being able to model this for our kids, helping them to think through all the names that emotions might have, knowing that there isn't just one emotion you feel, but multiple at the same time and a varied amount, is kind of a practical skill to go with. In addition to sort of thinking through emotions, we also know that when we feel really big emotions, there is always an urge attached to it, an urge to do, right? So when we think about feeling scared or fearful, the urge is to avoid or back away. When we think about feeling really, really sad, the urge is to isolate. When we think about feeling angry, the urge is to approach. When we think about love, the urge is to connect. So every emotion has an urge to it. And riding the wave, or that skill, is really thinking through that it's okay to feel big, intense emotions, and it's you can do things to help you sort of ride out the intensity. No feeling lasts forever, so that way you really have the freedom to choose what you want to do. So I really think of these skills as like providing you with some space to have the freedom to choose. You might choose when you're angry to still yell. That is a choice, but at the very least, it wasn't impulsive and it wasn't a knee-jerk reaction, that there was some space and you chose, right? So we want to give you some freedom to choose. So one of the skills that I wanted to highlight, we call it the tip skill. So this comes from dialectical behavioral therapy. It is an evidence-based treatment, particularly for teens and tweens and young adults who have some difficulty with emotion regulation. So TIP stands for temperature, intense exercise, paced breathing, and progressive muscle relaxation. So three things that really do something physically to the body. So as I mentioned before, when you're really dysregulated, feeling really intensely, that isn't the time to our go-to as a parent is like, tell me what's wrong. And it's like kind of sometimes the worst question to ask, because at that moment when you're feeling super dysregulated, it's hard to think through what just happened. I don't remember. And it's hard to speak sometimes. So sometimes just doing something, the behavior part of it can really help with some physical sensations and responses that really do help to turn down the intensity of your emotions. So temperature is really cold, so cold temperature. So one of the skills is, if possible, actually filling up a sink with really ice cold water, holding your breath and dunking your face in the cold water. So for a while, for like 30 seconds or so. So the coldness, and now if you don't have time to do that, you can also do this by holding ice on your hands, by taking cold packs and putting it on your neck. So the cold temperature in some ways actually provides sort of that like shock response. So physically you're sort of paying attention to something else, but actually holding your breath, dunking your face in water and cold water also actually does something to the brain where it's the diver's response. So your brain actually thinks that you're diving underwater, and it actually slows down your nervous system to re-regulate. So and again, you don't always have the ability to fill up a sink and do this, but it's okay if you can grab something cold. Changing that temperature, changing your body temperature can be really helpful. Intense exercise is just that. So when you're feeling really dysregulated, actually running in place for 15 minutes or doing something really intense. Sometimes I say, do push-ups or jumping jack, whatever it is, you're really getting your heart rate up. And then it's actually, if you've ever done intense exercise, on the downside, right, when you've been exercising and your heart rate is up and then you stop and your body slows down, it's that slow down, cool down process that actually helps to, again, re-regulate your emotions. And it helps physically to get your body to sort of turn down how you're feeling. So the other two, in addition to being part of TIP skill, they're also relaxation skills. So you can certainly practice these whenever, right? So paced breathing or belly breathing sounds very simple, but actually paced breathing is, we know, the number one skill to help with anxiety. So just being able, and it has both long-term and short-term effects. So in the short term, it helps to turn down stress and anxiety, but also long-term, if you practice paced breathing, it can be sometimes as effective as taking medication. So really what you're wanting to do with paced breathing is breathing from your diaphragm and breathing in through your nose all the way to the top of your breath and holding it for a few seconds and then breathing all the way out. And so doing that for about 5 minutes or so can really, again, you're pacing your breath so that way it re-regulates the oxygen in your blood. It's helping your brain, actually sending a message up to your brain that everything is going to be okay and you have this under control. And progressive muscle relaxation is really, again, taking different muscle groups, and this takes a bit longer when you're doing this, but you could do a shortened version of it. But it's really squeezing and tensing certain muscle groups for at least 4 seconds and then releasing for about 5 seconds. So I always start with my fists, and you kind of want to start in a T. So you're working from your fists to your muscles in your arms, to, you can do your shoulders, to stomach, down to legs, to feet. And you're, again, just kind of tensing. So if we were to do fists, tensing as if you're squeezing lemons for 4 seconds and then releasing. And really during the release, you're really wanting the time to really feel the release of your muscles. And so if you do that all throughout, the goal is that you're actually making your muscles feel more relaxed. And again, for that purpose of kind of sending a message up to the brain that you have this under control. So you're again changing the chemistry of your body and the physical sensations of your body to help regulate emotion. So that's tip. The other one I like is really using your 5 senses to, again, help to self-soothe. So self-soothe is really the skill in the moment to really tolerate distress, right? And so there are going to be moments where your kiddo is going to feel really intensely. And I like this actually as an activity to do beforehand, is really thinking through what would be in your self-soothe kit. And thinking through all the 5 senses: seeing, hearing, feeling, tasting, smelling, and creating a box. Excuse me, for teens and young adults, I've had them take some stuff with them to college, just really thinking through what is it in the moment that can be a go-to that I can, touch. And it helps me to sort of like just ground you to the here and now, and it helps you to soothe. Something I can taste, something I can smell. And that can really be helpful, as again, it's kind of a go-to, something they can do in the moment. And it also helps them to use already what they have in terms of senses and bringing them back into the moment. Okay, so sort of moving away from physical feelings and sensations, some of the behavior stuff that we talked about a little bit. Now we're sort of in the thinking part of that CBT triangle. And we can think about our thinking. So we know that thoughts are malleable and we can change them. We can interpret the same event very differently depending on our prior experience, depending on what our emotional state is in the moment, depending on our relationship with another person, the information we have. And what I tell the kids I work with too is that your brain is amazing and it makes thoughts all the time, and not all of them are important. So part of the skill is also sort of creating a different relationship with your thoughts as well, where you can listen to some and know when to not listen to others as well. So some of the skill is really kind of recognizing when we're falling into what I call common thinking traps. So when it comes to anxious thinking, we know that there are a lot of thinking traps we all fall into. We all do this. And I just highlighted a few in here. Really thinking worst case scenario, the worst case is going to happen, the most terrible of things, and then I won't be able to cope. Predicting the future, predicting that something in the future is going to be terrible. It's usually not predicting the good things, it's predicting it going terribly. Mental filter is sort of having those blinders on where you can only see the negative. So maybe many good things happen that day, and one thing that just didn't go your way happens, and that's all you can see is sort of like, oh, my day was terrible. I did an awful thing. And there's others, right? So mind reading. So assuming you know what the other person is thinking. If they think I'm terrible, they think I'm the worst. Labeling. So labeling yourself unfairly. I'm stupid, I'm dumb. And the list can go on. So part of this skill is really helping to think through that thinking and really recognizing when you're falling into that thinking trap. And the goal is, once you get really good at sort of identifying those thinking traps, or identifying times when you fall into those thinking traps the most, is trying to replace those thoughts. So what I usually say is you're not trying to go from terrible thinking to like happy thinking. That's not realistic. But really trying to think through what is the evidence that this thought is true. So more realistic thinking, focusing on coping. So sometimes that happens. Sometimes you told a joke and it didn't land well and nobody laughed, and that's okay. And so how to cope through that, how to cope through things not going perfectly or well, and not self-blaming or not personalizing it, but what can you do? And the other is really focusing on gratitude. So, and this isn't in a way to invalidate the feeling, right? So you can certainly feel anxious or sad, but how is it that you can, at the end of the day or at some point in the day, turn to gratitude and say, oh, I'm, grateful for small things, like I was really grateful for that cup of coffee this morning, or whatever it might be, and how we can look at silver linings as well. But the other part of it is what I mentioned before too, is really thinking through our relationship with our thoughts. And so sometimes in the moment, it's really hard to replace a thinking trap or think of something else to sort of change the narrative. And so sometimes what we work on is acceptance and sort of changing the relationship to that thought. So I like the analogy of thinking of your thoughts as a parade, and you want to watch the parade. And if you find yourself in the parade, then you're engaging in your thoughts. But if you once you're like marching along and you recognize that, how is it that you can like set aside, recognize and acknowledge the thoughts, but yet not be in them? And so what that might mean is like not going down that rabbit hole of a thinking trap. So you might have the first thinking trap of like, oh gosh, I really failed that test. And then the rabbit hole can be, and I always do this. I'm such a loser. I can't believe that this happened. I'm never going to go to college. I'm not going to be ready. And that's engaging in the thinking trap. So how is it that you can be like, oh, I did that. Yep, this is how I feel. And I'm going to take a step back and sort of watch it go by. I don't have to change it. I don't need to do anything about it, but I also don't need to engage in it and sort of go down that trap. It's very hard. That is not an easy skill to do, and it takes practice. And lastly, just wanted to highlight too some scaffolding of behavior. So this is for kids I work with that might be really feeling anxious about the beginning of the school year and, having to give presentations now in front of a class as opposed to via Zoom or whatever it is, engaging with peers. And so how is it that we can sort of break down a goal and start with things that are doable and work our way up? And this is just an example, again, of giving a presentation, but really breaking down a final goal into doable steps and thinking through, how can we get you started? Where can we go? How can we practice? If kids are feeling really nervous about being back in the school building, taking this opportunity to drive by or to go visit already, or reaching out to teachers and seeing if they'd be willing to talk to your kiddo, or reaching out to classmates that will be in his or her class. So really kind of starting that scaffold process now. And lastly, just thinking through this past year and a half or more and continued, one of the most resilient factors we know when it comes to the stress of the pandemic is really meaningful connections and really building that community, and it takes a village. So how adults respond to kids and how we connect with them and how we make them feel empowered is really key in helping them cope and helping them get started this school year. So really thinking through those meaningful connections to them as well. That was it. So I'd love, we can certainly open it up. I don't even know what time it is. Okay, it's 10 to 9.
It's 10 to 9.
So we can, I know I went through that fairly quickly, so I can certainly open it up to questions or thoughts about what supports do you think your kids would need to be successful this fall? What do you want schools to look like? What was helpful for your child this past year, or just questions in general? I'm open.
First of all, Dr. Domingues, thank you so much. It was wonderful, really wonderful. And I'm sorry we had that confusion at the beginning.
No worries.
But I'm sure that people have a lot of thoughts and are reflecting on what you've just said. So please just take yourself off mute if you have any questions, and we'd love to hear your thoughts. I do have a thought. I'm sorry, I do have a question.
Yeah.
What would you suggest? And I guess this is me going down the rabbit hole. If our kids do go back to school in person, and then we have to resume Zoom again. Again, it is going down the rabbit hole, but it could be a reality with this Delta virus, and I think about it.
Yeah, I'm certainly thinking about it as well. So I think the silver lining there is that we've done it before, so that's good. We that could be that, and we can take what we know from before and what's worked to sort of make it work this time around. So if school's in session for a bit and then we have to go virtual, sort of what were some of those things that were really helpful this past year? I certainly think of the kids who really, I get it, really struggled with virtual learning, really did not like it. And so my hope is that we wouldn't be virtual for too long, and that schools are sort of a bit more equipped to make it a bit more successful this time around as well, sort of like lessons learned from last year. I think as a parent, and as a caregiver, what you can do is sort of prepare emotionally as much as possible. I think you guys know your kids best and sort of how they're going to react to, the news and what they're going to need to sort of get into that headspace and that mental space to sort of, at some point sort of accept that, all right, this is happening. I think I just, going back to what we were talking about before, sometimes the more you try to push away the reality, or you sort of get frustrated by it and you're like, not again, you can certainly have that moment. That's totally valid. And at a certain place too, it's kind of like, all right, and this is the reality, so what can we do to come back and sort of make it successful this time around, or for right now, and take it sort of week by week, and hopefully this doesn't happen and we'll go back to being in person. Yeah. But also being in person is going to look a bit different too. I think there was some hope and that it was going to be more normalish, and we'll see what the variant brings. So that's, maybe less about being virtual, but more about like what the expectations are going to be sort of in school and what that's going to look like, and mask wearing, and sort of how social can you be at school. Those might also be some conversations to be had as well.
And I was thinking about what other supports can we give outside of the home? And I am a huge fan of the Child Mind. What age does the Child Mind start working with children?
Yeah, great question. So we work with kids as young as, 3. And we go up to young adults and adults, in all honesty. So we see some adults too, but I work with a lot of folks that are in college and tweens and teen age, but we work with youngsters as well, so as young as 3. Mm-hmm. Yeah. I know it's hard to think about this stuff since, it's August. The summer also feels like it flew by, in my opinion. So, yeah.
I'm also wondering, if nobody else has questions, I do. I am wondering if you could speak a little bit about DBT and CBT. I know CBT is worked in through the DBT, but would you mind just going over the DBT structure just a little bit? Because I know has a lot of strength.
Yeah, absolutely. So dialectical behavioral therapy is rooted both in CBT and also mindfulness practices. And DBT program usually has like 4 components to it. So individual therapy. So you meet with an individual therapist. There's a group-based component as well. So usually the group-based component is really kind of like taking a class. And so you go through different skills in group. And then usually with your individual therapist, you sort of work through how is it that you're practicing those skills, how to incorporate it into sort of everyday living. And then the other 2 components are really around the therapist. So we also have our own group consultation where we're sort of practicing through skills as well. And then there's also phone coaching. So with the DBT program, we do phone coaching for our teens and tweens and also parents as well, in the midst of sort of maybe a really difficult time where somebody's having a lot of dysregulation, and we can be there to sort of help think through some skills to use in the moment. So that way, again, sort of making it effective. Mindfulness runs, is kind of like the common thread throughout everything. And so when we're thinking about that group-based component, every group session starts with mindfulness. There's mindfulness skills that start each of the 4 sort of core skill kind of like skill groupings. So we go through distress tolerance. So skills, again, that, I talked about today, skills that you can use in the moment when you're feeling really dysregulated to tolerate distress. We go through emotion regulation. So really skills to use to help regulate emotions, whether it's understanding what emotions do for you, sort of increasing pleasant activities in your life, how to eat, how to exercise, how to take care of your body, because that certainly makes you more vulnerable to emotion dysregulation. We also have interpersonal effectiveness, so skills to really help interact with others in a way that's effective for you in maintaining relationships and maintaining healthy boundaries. And then there's a walking the middle path. And so that's really around validation, communication within the family, and just helping sort of that interpersonal effectiveness within the family as well. So those are kind of the 4 core components in addition to mindfulness. And I like to think of it as life skills. I think anybody can use these skills.
Yeah.
I certainly, when I did my DBT intensive training, I was like, I wish I had this when I was growing up. This is really helpful.
Yeah. We all could use it. Yeah.
Yes.
I have a question.
Sure.
So I've got one boy who's in college. He's a rising junior, and another boy who's going to college. And both of them have accommodations in high school. And they're very reluctant to use their accommodations in college. And I was just wondering if you had any advice as to how to encourage them to, I don't know, see the accommodations differently, or see how, how it can help them, and how they can advocate for themselves. Because in school, especially in college, especially, they don't want to hear from the parents. They want the kids to be able to do it for themselves. And I get that, but part of the accommodations have to do with, not being the best advocators. So I was just wondering if you had any insight into that, how to get the kids to be more accepting of their own accommodations.
Yeah. Well, I guess before starting, or sort of like, this might be for your kiddo who's going to be starting this year, I always recommend, and I always say, like, even if you never use it, and you probably did this, you go to see where it is, so I think people are always more likely to do something once they have done the walk to the center and have met some people and sort of know what the process is like. So they might be a little bit more willing to do it when they need it. I think the tricky thing is that, right, every year when the year starts, you sort of have to make your professors all aware of your comment. Like, I think that's the part that might sometimes get in the way, is like, oh, I have to do this again. And so it might be sort of thinking through, like, where's your stuck point? Is it that, like, you don't want to talk about it again? You feel embarrassed by it, like you have to tell your professors again at the beginning of the year, and it might be that. And so how can we make that a bit easier and just kind of get it done and over with? It might be that. And so once they do the one and done, they're like much more willing to sort of like advocate when they need it. So I think sometimes, even though this might sound counterintuitive, it's usually easier to do it before you're in distress and in crisis and have it set than in the midst of crisis. And the other thing I would add, but maybe they have great services, is not every college does have great great accommodations or great centers. And so I might talk to them about, like, well, have you gone there? What's it been like? Because I think sometimes you can be like, oh, just go, like, this will be really helpful. But sometimes I'm like, I don't even know if it'll be helpful because I don't know what they do for you there. Like, tell me about it. And so I just kind of open it up and ask them, like, sort of what their process is like and what they need. So, yeah.
Yeah, no, thanks. I have one other question.
Yeah.
If it's okay. What comes up a lot for some of the parents that I work with is that, their child explodes, calls them all sorts of names, and the parent gets stuck in I can't allow my child to speak to me like this, right? And we talk a lot about letting them have their feelings, and it's important, acknowledge their feelings and work with them. And then when do you talk to them about it's not okay to call your father an asshole? Like, when do you address the behavior? When does that come?
Yeah. So we strike when the iron's cold, so not when it's hot. And so in those moments, I think where we get stuck, where I can get stuck, is like kind of the back and forth of like, don't talk to me that way, and then like the whole thing is missed. At that point, you're not validating emotions, and I get it. It's really hard to, when a kid's cursing in your face, and also but also it gets lost, and you think you're making a point about behavior, but you're not, because like their emotions are too high and then your emotions get really high, and sort of nothing gets accomplished. And so even though it's incredibly difficult to do, at that point it's disengaged. Like, in that moment it would be disengaging, because the truth of it is, even if you're like, don't say anything, you're paying attention to it, it sort of like increases the behavior. So to disengage, if there are moments, then to sort of like hear out how they're feeling, or we'll come back and sort of talk about what happened. But striking when the iron's cold is kind of like the preemptive part of it, right? And what I would say is, it's not just saying don't do X, Y, and Z. It's also giving them an alternative, because what you're really wanting to do is reinforce the behavior you want to see. And that's always the tricky part, is like, what's the positive opposite of cursing? What is it what outlet can they have if they're really trying to express an emotion to you? And it might mean like, go to your room, let it out, come back, and we talk about, or whatever it is, so giving them an alternative, so that way you have something to come back to and be like, I really loved how you did X, Y, and Z. I know that was really hard for you. And that way you can start to shape behavior differently. Yeah.
Thanks. Makes a lot of sense. Thank you.
Mm-hmm. That's always a hard one. It's hard not to get, not have your alarm go off when something like that happens.
Yeah. When the parents get triggered, and then everyone's just.
Yeah, totally. It's rough.
The parents are just as dysregulated as the child, trying to tell the child not to be dysregulated.
Oh, absolutely. Yeah.
Right.
And I get it. I mean, it's hard. Yeah.
I think one of the important things too is for parents to just give themselves permission to be human beings and make mistakes and
Yeah, and I think that's a
passionate
lovely,
themselves.
like a lovely thing to do too, and come back and be like, I want.
Temporary tourist visa. It's only for a couple of weeks or a couple of months. Like it's up to a month, I think.
I'm sorry, Denise. Denise, thank you.
Yeah, and coming back and being like that, I was really angry and I misspoke, or I shouldn't have done X, Y. I wish I had done X, Y, and Z, and I'm going to do it next time, or I'm going to try harder whatever it is,
Yeah, modeling and modeling behavior that you want, that you're asking them from them.
Right.
Yeah.
Anybody else? Joni, I feel like you and I can pick Dr. Dominguez's brain all night long.
Oh, I could keep going for sure.
Oh, me too. I want to give other people a chance. It's interesting. Joni and I were having a conversation before you got on. We were talking about incentives, rewards versus consequences. And I'm wondering if maybe, I know it's a very broad topic, but in regard to really the younger kids with incentives versus consequences, do you have anything overall to say about that?
Yeah, so I think before sort of getting into the reward part of it or the consequence part of it, because I think sometimes as parents, I do this too, like you get into the reward part of it too quickly. You're like, oh, and then you earn a thing, and it's, but the truth of it is, it's hard because you want to be incredibly specific about the behavior that you're rewarding, and sticking to that. So, because, rewards do help, and they help with things that are hard, so I always tell parents that too, like because I certainly work with parents who are like, but I don't want to bribe my kid, or I don't want to, can't they just do this on their own? Like, nobody's rewarding me for doing X, Y, and Z. And I get it. Yes. And the way I think about incentives is really just getting the process started, because it's hard. And so we're helping our younger ones really focus on the behavior that we want to see. And that's why rewards are effective. Consequences have their place too. I think you don't want to give consequences for things you don't want to see all the time, especially if there are behaviors that you can ignore, because while it might not make sense, certainly negative attention is attention, and that can actually increase the behaviors you don't want to see. So I think it is thinking through consequences for things that aren't okay, like house rules, right? What are your house rules? If they get broken, then these are the consequences. Don't make consequences on the fly. They never work. So in the moment, that can't, you can't just come up with a consequence. It sort of has to be preset. So that way they know what to expect. Yeah, but rewards can be they both can be challenging. And only my other piece of advice is like stick to one or two behaviors. Don't reward everything, or because then it gets really hard. Mm-hmm.
I have a question about that. I'm not like a big rewards fan, but that being said, what about when the child, like, as far as like anxiety and the child, there's a particular behavior that the child is having trouble with, and the child selects their own, more like a goal that they're working towards. So every time they do this behavior that is so difficult, they get, something towards that goal.
Mm-hmm.
So they're working towards their own goal. Is that something it sounds like it would be effective, right? So they would ultimately reach their goal, but does that help them with the behavior that they're having trouble with if they're doing it to work towards a goal versus addressing that behavior head on? I don't know. Like, is that an effective strategy?
So if I understand the question, which I think is it like, is the worry that like once they hit it, they get their reward, then it's like, okay, I'm done with practicing this thing? Is that what you mean?
No, actually, it's like they get they reach the goal, but have they done the work around the behavior that they're having trouble with?
In terms of, for like, I guess I need to know what this.
Okay, so say going to school, having trouble going to school,
Sure.
right? And every day you get yourself into school, you know, something goes in this jar, and when this jar is full, you get to have some predetermined thing that the child has decided on that they're working towards.
Sure.
Does that help with the school anxiety if they fill a jar?
Yeah, so if a kiddo is having difficulty going to school because of anxiety, going to school.
Janine, I can't, you're all garbled.
I'm gonna pop out and come back in.
Okay.
Don't go away. Please, everybody, feel free to share your thoughts.
Yeah, if anyone has any questions, just jump in.
Joni, I think she's going to charge us for a session, a personal threesome.
I know. Do you understand my question? Oh, wait, let me let Dr. Dominguez in. Okay.
Here she is. Great.
Welcome back, Dr. Dominguez.
Thank you. So my Zoom, like after an hour, my Zoom makes me sound like Darth Vader. I don't know why. It happens all the time. So yeah, if anxiety is what's preventing a kiddo from going to school or making it hard to go to school, what we know about anxiety is that the practice of going, theoretically, a kiddo should habituate to that anxiety, and eventually that anxiety gets lower and lower and lower. And yes, and then sort of, you know, the behavior of going to school gets easier. I think where it gets a little tricky is like when it might be more complicated than that, right? And so, or when a child's anxiety is so high that no matter how often you're doing it, you know, their alarm is so intense at the beginning of doing it every time that they're actually not habituating, and that, you know, we can talk about sort of the role of medication in addition to exposure work and sort of the behavioral work. And that might be, you know, another discussion of how, you know, the treatment planning for that. But the hope is, yes, when you're being sort of, like you were saying, incentivized to do like the next step and then the next step, the hope is that that by habituating to the anxiety and getting through it, then things get easier. And then you don't have to get, you know, reward. Maybe, I don't know what the next reward is, but you know what the next step is, or the reward becomes, you know, intrinsic, and you just like going to school now because you know you can do it, or whatever the case is. That's the hope. Yeah.
I'm actually looking at the time, and I know you have a big day tomorrow. So I am going to say thank you so much from Chad-Bergen County. And I'm wondering if there is anything else that you'd like to say about the child's mind or the work that you're doing there. Please, I just want to give you the opportunity. Sure.
Yeah. So, yeah, I guess in terms of resource, you know, certainly childmind.org visit. We have a ton of resources. And knowing that the hope, fingers crossed, is that we'll be more back in person too in the fall, but also doing a hybrid model of telemedicine as well. So the silver lining a little bit about the pandemic has been knowing that telemedicine can be effective and we can do it well. So that's been helpful. Yeah, so, you know, and good luck to everybody in the fall.
And Dr. Domingues, I just want to say that it's amazing how small this world is, because I have had so many conversations with either clients or friends, and your name just keeps popping up. So you are changing the world slowly. Thank you for all the
Excellent.
wonderful work you do, and you've touched my life, and I can't thank you enough for being with us this evening.
Oh,
You
thank
so
you.
much. And I will let you go finish packing, as
Thanks.
Joni will take a few minutes, please, to give announcements for our chat chapter.
Thank you.
Thanks
Thank
so
you
much,
so
Dr.
much.
Yes.
Thank you.